Good morning, and we welcome all of our viewers to Online Church. Today's topic is Healthcare Worker Insights. My name is Dr. Henry Toe. I'm a surgeon. I work in Melbourne, Australia. And once again, we welcome all our viewers to share today what are some of the things healthcare workers are doing behind the scenes, especially during this pandemic time. I'd also like to introduce my co-presenter today, Pastor Kojo. Good morning. Okay, I think we might have a bit of technical difficulties with Pastor Kojo at the moment, so we'll see if we can get him back online in a sec. But I might just start off by talking a little bit about healthcare workers. What are some of the things that we are doing behind the scenes at the moment, and what are some of the aspects that we can share about what they're up to, especially during this difficult time? Now, when we think about healthcare workers, we might consider some of the aspects that the characteristics that they must have in order to join this profession. You might think about healthcare workers serving others, putting others first, being there at times of need, having health interventions, having a team effort, and of course, having a sort of job that is always going to be in need. And if you look at this first slide, we can see that after an interview of intensive care nurses and doctors, with a survey was performed a number of years ago, and they gathered together some of the key topics and key thoughts that intensive care nurses and doctors had about their own profession. They gathered together some of the ideas and the themes that they felt were important for them as healthcare workers. And some of these themes are things such as health, psychology, satisfaction, and we can see on this next slide, having a good environment, having happiness, and also having support as well, especially that they do face a lot of difficulties, such as dealing with patients and difficult situations. There are things such as depression and anxiety that do creep into their profession. And so it can be difficult to be a healthcare worker, and especially during this pandemic time, we are seeing healthcare workers being greatly affected by the things that are around them. Let's go on to the next slide, and we can see that healthcare workers face a very hazardous environment. They face an increased risk of developing coronavirus or being exposed to and then ultimately contracting coronavirus of up to 5 to 10 times that of the community. So just imagine what it would be like if you attended work and you had a 5 or 10 times greater chance of contracting a deadly disease. And that is what healthcare workers are facing day in and day out. Each time that they go to work, there is a chance that they may be affected by coronavirus. And this, of course, is having great effects on their mental health as well. So on this next slide, we can see much greater mental health effects, especially during this pandemic time, on healthcare workers. A recent survey done through the International Journal of Emergency Medicine has shown 1.5 times depression, 1.5 times anxiety, 3 times the amount of insomnia, and 1.5 times the amount of distress that are caused just simply from the work that they are doing. And that, of course, is going to have a profound impact, not only in the short term, but in the long term. Fortunately, we don't know how long this pandemic is going to go for. It already has lasted more than 6 months. There isn't really an end in sight. And day in, day out, healthcare workers are facing the challenge of knowing that they themselves may be exposed and may even contract this virus. And if they do get this virus, the personal effect on themselves and their family will be profound. And to go in, day out with this sort of insight can be very difficult, particularly on your mental health. So now let's see if we can just share some personal insights as to what has been my own experience and also the experience of some of my colleagues during this time. Now, for me, as mentioned, I'm a surgeon and I have performed operations during the last 6 months. And some of the operations I have performed have been on patients that have been COVID positive. This means that we are at direct risk of developing coronavirus during these operations. Now, when I think about my own experience about operating on someone that might have coronavirus or that I myself might be exposed, it's a little bit funny. You go into a frame of mind where you just do it because of duty. You do it because there is need, that a patient requires help, and maybe putting aside my own risks and my own potential outcomes, I just sort of think, well, if we need to do this operation, we need to do this operation. I have the skills, I have the abilities, and I will need to do this to help this patient. But also, I have to have a bit of a trust in the system that is around me. And there is systems in place before operations just to make sure we are adequately protected, and that is what we call the personal protective equipment, and we put on various gear. So just to go through one example of an operation that I performed a number of weeks ago on a patient who was then known to be COVID positive. We had to put on the special face mask, which is not a normal face mask, but is, as we know, the N95, which is the face mask that has extra seal to make sure that virus particles do not get in. We all wore face shields, a special hood, and of course the protective gear, the extra layer of protective gear around us. Then one by one, we had to put on this protective gear in a systematic way, enter into the operation, perform our part of the operation, whether that be myself as the operating surgeon, the nursing staff setting up the equipment and helping us with the equipment, the anaesthetist who was involved with the intubation of the patient and caring for the patient and ensuring that they were asleep and comfortable during the operation. Each of us had to perform our part. And then one by one, as the operation was finished, one by one, we had to then walk away from the operating theatre and carefully don off or take off all this protective gear in a systematic way and dispose of it, washing our hands and making sure that we didn't have any infection. Now, as we can see, it was quite an ordeal. We had to go, as we put on the gear and took off the gear, we had a special spotter, which is a nurse that's in charge just to make sure we're doing everything the right way and we're disposing of all of our equipment afterwards as well. And as you can see, as mentioned, it's quite an ordeal and it's quite stressful. Just when you put on all that gear, you really sort of feel like like an astronaut, I guess. You're like an astronaut going into an airlock, and then you're going out then into an exposed environment that could be very hazardous. And as you come out of that environment again, I guess there is some relief that you're out of the environment, but then you also know you may not be entirely in the clear, because even one small breach of that PPE, you can be directly exposed to the virus. Now, I have another colleague who works as an anaesthetist. An anaesthetist are doctors who take care of patients, especially with their cardiorespiratory, so that's the breathing, the heart, and the monitoring during operations. And they're also directly involved if a patient is very sick and can't breathe. They're the ones who are involved in order to intubate the patients who are very sick. And because they are directly involved in the upper airway area for those patients that can't breathe, then they can be directly exposed to coronavirus. Now, I had a conversation with one of my colleagues who was an anaesthetist, and day in, day out, they are seeing patients who have difficulty breathing, who might be COVID positive or might be directly exposed to others that may have coronavirus. And there's a lot of stress for this particular anaesthetist and what they're going through. He has had colleagues who have decided not to work during this time because of how high the risk actually is. And he himself, because he's exposed to so many patients that have difficulty breathing who may have coronavirus, he's almost saying, I'm expecting that I myself will get infected one day. Like, eventually there's going to be a breach of my PPE, of my protective equipment, and I'm going to get exposed to the virus. And to be able to work day in, day out with an expectation you may yourself get such a deadly virus is very harrowing. And I feel very I feel very empathetic to his situation because he's much more in the front line than I myself as a surgeon, who probably is one step back from that. And some of my colleagues have had multiple coronavirus tests. This is 7, 8, 9, 10, even in the teens. And that's the number of times that they themselves have had a potential threat of being exposed or have had minor symptoms. And every time they have a test, they have to be isolated away from their family and their friends for the time they're waiting for the result. And every time they have a test, at the back of their mind, they're thinking, if I do get this deadly virus, what is going to happen to me in terms of my personal health and my work? And there's been many changes in terms of hours that doctors are working. There's constant changes in terms of sometimes they have to work longer hours, shorter hours to cover for people who are off on isolation or furlough. But they just have to keep going. And one of the difficulty, probably one of the most difficult things that we are experiencing as healthcare workers is the uncertainty. And that uncertainty is that we don't know how long this is going to be going for. So now I think we have Pastor Kojo back again. I might just give our tech team a minute or so to see if we're able to get Pastor Kojo back. Okay then. If not, then I'll just continue sharing some of my insights to see. We might have to give him a couple more minutes for him to come back on the live stream here. Yeah. So what else happens behind the scenes in a hospital? Now, before I go into some of the day-to-day things that occur in the hospital settings, I do want to go a little bit into what it's like to prepare to be a prepare to be a doctor or a healthcare worker. Now, healthcare workers range from doctors, nurses, allied health, physiotherapy, occupational therapy, dietitians, social workers. A lot of healthcare workers have to go through a period of training before they're able to professionally work at a hospital or in the medical field. Just in the medical field itself, being a doctor, it's quite a long road to be a doctor, and many colleagues of mine have a very similar experience as well. The study period is long and is quite a journey, and the reason why is because the human body, being so wonderfully made, is very complex. And we need to understand all the ins and outs of the anatomy, the physiology, the biochemistry of the human body, and that takes time. You can't be in a hurry to have a deep understanding about the human body because there is so much complexity to it. And then first to understand the healthy human body, and then to translate that over to the diseased human body and how certain pathologies, whether that be viruses such as coronavirus, bacteria, injury, various medical conditions, cancer, how this affects the human body is the next stage after that. And then finally, how do we manage and how are we able to treat patients who have certain illnesses and diseases? Then going on to the stage beyond that, and that is not only understanding the human body, not only understanding how diseases work, not only understanding the management, but how do we apply this to patients in an empathetic and in an appropriate way? Because we understand that not two humans are the same. And two humans also approach their health in a different way. And for doctors to be able to recommend treatments, it is actually an art to apply a certain management plan to a patient in order for them to be accepting and to be compliant to that management treatment and hopefully get them through to the other side when they are well. And as you can see, this is quite a long road for you to understand all these different components of health. And so because it is such a journey, there are many sacrifices that are taking along the journey of training and then developing ourselves into medical doctors and developing ourselves into ones that are effective in our workplace. A lot of this comes through assessments, and there are a lot of assessments. For those who are planning to be doctors, one of the first assessment that you have to go through is actually getting on to being admitted into medical school. And that itself requires a lot of hard work, a lot of exams, interview preparation, and to finally be selected onto a medical program. And that takes a lot of hard work. And then there are ongoing assessments and exams along the way. In medical school, there are multiple assessments that are being done at various points, whether that be an exam on a certain topic or even your final assessment before you're finally admitted to be called doctor. And thereafterwards, there are ongoing assessments and exams thereafterwards, because as a doctor, you may work in various areas, whether that be in the community as a community doctor, a general practitioner, whether you work in surgery, such as myself, whether you're a physician, whether you are a radiologist or a pathologist, an ophthalmologist. There are many different subspecialties within medicine, and in order to stream into these subspecialties, there are assessments and exams. And many times during these assessments and exams and preparation for them, our lives are constantly on hold. There are times when an important exam is coming up and you might put off things, such as you might put off a holiday you might be having, you might put off a trip or meeting up with family, you might be studying on the weekend rather than going out with your friends. You might be, and even in the extreme case, people have put off their weddings until after the exam is done, and they even put off having children, saying that's not a good time for me to start a family now because I have because I have exams and assessments coming up, and those exams and assessments are far too important. I can't be interrupted by starting a family. So you can imagine what a great disruption that being a medical doctor can be to even the normal passage of life, and what kind of sacrifices medical doctors have to take behind the scenes just to prepare themselves to be doctors within a hospital or within a community. So a lot of sacrifice and a lot of things to get us along the way. So might just go back to our tech team now and see if we are close to getting Pastor Kojo back again. We apologize for the technical difficulties. And yeah, that's so great to see you again, Pastor Kojo. Good morning. Yeah. Great. I might just have to make sure we can hear you on mute now. So just get yourself off the mute there, I think, Pastor Kojo. If you could just get your microphone working, that'd be great.
Hear me now?
Yes, that's great. Yeah, thank you. Great. We've got all of the technical difficulties overcome.
Hopefully. Yeah, we had a few issues with the technology. Yeah, apologies for that.
Yeah, no problem at all. It's just good to see you. Yeah, I've just been going through what a hard road it is to be a doctor. Not to say that, you know, it hasn't been enjoyable and there have been good things along the way in that process. But doctors and nurses as well make a lot of sacrifice just to even start working. And when we finally do start working, there are also more challenges along the way.
Yeah, I really do appreciate the work that healthcare workers do, especially doctors. I remember being, when I was much younger, I used to visit the doctor quite often. I remember one time I had a broken bone and I had to go and see the doctor. And so I have, should I say, fond memories of doctors, because they always appeared very caring, and, you know, they always spoke to you in a very gentle way, and they looked like, you know, they were really interested, you know, in you. So, so have a very good image of doctors.
That's great. Yeah, thank you. And as we were saying, they do make a lot of sacrifices along the way in their training, and a lot of sacrifices as well during this difficult time. You know, we hear a lot in the media about how doctors are going, and nurses and other allied health professionals are going behind the scenes. But you know, even on a day-to-day basis, there's a lot of sacrifices going on, aren't there?
Yeah, and you know, that's why, you know, I really appreciate the work they do, especially during this time. You know, doctors are going out of their way, you know, putting themselves at risk, and trying to, you know, make sure that people are healthy. And I heard a story about a lady who actually, one of the doctors who actually got a fine. Did you hear about that?
Yeah, I know. How unfortunate. So she was, this happened in Melbourne, and she got a fine because she parked her car, went to work in the intensive care, I believe, And then when she came back to her car, the city of Melbourne gave her a fine for parking too long or in the wrong place. That is extraordinary, isn't it?
Yeah, I'm sure she wasn't pleased.
Yeah, that's right. That not quite showing your appreciation for the hard work you're doing for patients in the hospital.
Yeah, because you're right. I mean, after all that sacrifice, and if this is the outcome, if this is how you perceive that people are, actually appreciating the work that you're doing, that will not go down very well. But yeah, we obviously you do put in a lot of hours. I've had friends, who've been through medical school, and they tell me the amount of hours they have to put in. And even when you're working, I understand that, it doesn't stop. It just keeps going on, and they put in extra hours for which you're not getting any extra pay.
Yeah, that's right. Maybe I'll talk a little bit about what does happen behind the scenes and those extra hours. We actually are, as doctors, are constantly thinking about patients. And it's a bit funny to sort of say that, but even when we're outside of work, we are considering and thinking about certain patients. I've done some operations during the week, and I've been just thinking about how these patients are going. Are they well? How are they recovering? I might see them in the hospital, but you still wonder what it's like during their recovery when they're going home. And I do think back about some of the operations that I've done and whether, was this part of the operation didn't go so well? How could I improve that? This other part of the operation also maybe didn't go so well. Is that having an impact on the patient? There's quite a lot of other things that we do think about. And I've also had some difficult cases in the past few weeks, and there've been other difficult cases in the hospital. And as doctors, we meet together, we audit, and we discuss about these difficult cases, and we go through how we can improve things. And so because of that, we are constantly thinking about patients much outside of those hours when we're actually in the hospital to see how can we improve things, or how are patients going, or maybe there's something else that I can do to help these patients in another way.
I see. So it's almost like, going the extra mile is part of the package. It's not something that, is isolated. When you're actually working to care for people, you're not only thinking about, the exact job description and where the job actually ends. You're going the extra mile. You're actually thinking of your patients, even when you're not working at home. So that kind of eats into your personal time. Does it impact on your family?
Yeah, it does actually, and probably one of my recommendations, if anybody is dating a doctor or knows other doctors, is probably not to marry a doctor, because you do get a lot of personal time that unfortunately is eaten into because you work in this field, and it does. Yeah, probably one of the main sacrifices is in time, that there are, you do compromise your time because you are thinking about patients, or maybe thinking about training or education, or trying to better yourself in some way. Mm-hmm. And that does eat into time where you normally would be doing other things. Now, it's not uncommon where right in the middle of very important events, whether it might be a birthday party or even a wedding, that doctors would be called away because there is a patient in need, or there is there is another emergency that they do need to go to. And unfortunately, it's actually the families of doctors that are the ones that are affected, because they don't get the full attention of their husband or their wife or mother or father. Because there is this constant potential of having someone else that needs you. Yeah.
Well, that's really humbling to know that you go to such lengths, to actually look after our interests. So obviously, so you're making sacrifices. So you're making personal sacrifices as well. You're not only just attending to the patient, but you're making personal sacrifices as far as your family is concerned. So obviously that takes its toll, doesn't it?
Yeah, I think over time it does. I think that there is eventually a sort of an understanding, I guess, between you and your close family, that they do understand that this is the area that you do work for. But I think that also on the personal level as well, it's very important for healthcare workers to be able to debrief. And part of that debriefing might just be being a bit open about what has happened during the day, whether that be bad things or even good things that happened. And nowadays there is a much greater focus on healthcare workers on their personal well-being, and that is just because in the olden days they may have to just hold in everything that they had. All these stories of good or bad outcomes would just have to be ones that you just take on the chin and keep going and try to keep doing better next time. But nowadays there is a much greater focus on well-being, and part of that well-being is to be able to share some of the experiences that healthcare workers are going through, whether they be good ones or bad ones. And by sharing the load, by being open about some of the experiences and the sacrifices that you are making, just helps you to release some tension and be able to take these issues off your mind and be able to know that there are people that understand and care for your personal well-being as well.
Wow. Yeah, thanks for sharing those insights. So I guess the healthcare worker, the doctors have to look after themselves, isn't it? You have to be healthy enough. You have to look after yourself in order to be able to look after your patients. So I guess I'm asking in my mind, I'm thinking, okay, so with all this sacrifice, how can we support? Because my typical impression of a doctor is I go to the doctor, say I go to my GP, I sit down, I tell the GP, what's wrong with me. She looks at, takes some tests, does checks me up, and then writes me a prescription. And I think, oh, that was like a 5-minute job, a 10-minute job, and that's done. But it's not like that, is it? So I guess, so how can we show our appreciation and, for the sacrifice, the big sacrifice, the great sacrifice that, our healthcare workers are making for us, especially during this time where we're suffering from the COVID-19 pandemic?
Yeah, I think that's a great question. And the appreciation, I guess the main appreciation that healthcare workers get is the fact that people are well. And I think that that's probably the most important outcome, that people are able to get well and that we hear these good news stories. But especially during this pandemic time, if we just ask our tech team to show the slides, there are a lot of appreciation that is going around nowadays about it could be things such as, if we go forward a slide, we can see that people are saying a lot of thank yous to our healthcare workers through soccer T-shirts or painting it onto the soccer fields. They're lighting up famous landmarks such as the Eiffel Tower or even Disneyland, just to show appreciation for the healthcare workers. And these are definitely being noticed and definitely being encouraging to help healthcare workers to keep going and doing what they're currently doing. But a recent survey through the Harvard University, and that was replicated again through various major medical journals, show what do healthcare workers actually want, especially during this pandemic time. And on the next slide, we can see what those top 3 things are. Sorry, just go to the next slide again, sorry. The top 3 things that healthcare workers actually want on the following slide is number 1, just public support for health policies. And that is to say that if the chief health officer or if the government is advocating a certain type of health policy for us to overcome this pandemic faster, then that will help the healthcare workers in terms of easing the burden of disease within the hospitals. And if we're able to get good public support, people are able to comply with the rules and we're able to overcome this pandemic time all the more faster, that'll be really, really great. The next is just a safe work environment. And we could briefly see on the previous slide about some healthcare workers advocating not to call themselves heroes. We're not, these superheroes that want to overcome, all these great obstacles and defeat this virus head on. But more so, we're doing this out of a professional obligation and being able to do it in an environment where healthcare workers feel safe. And if they are able to feel safe, then they're able to do their job effectively and to help the patients in need. And together with that is things such as job security and also care for their family if they were to be affected. And then the third thing that healthcare workers want, and that is just simple courtesy and kindness, that if any patient does present to the hospital, just an understanding that we're here to help. And if we are here to help, then we also hope that people can treat healthcare workers with respect and with courtesy, because we want to aim to get them better, even though they themselves and the patients may be going through a difficult time. So 3 simple things that healthcare workers want.
Well, I don't think that's too much to ask, for public support, and, to work in a safe environment as well. I think these are things that, we can actually, support healthcare workers with. But from what you're describing, I can say that, our perception of healthcare workers, being, respected, going out of their way to support people, being altruistic, and just trying to make sure that people are healthy and live a better and healthier lifestyle. I think it's worth it. It's a right perception from hearing the challenges, and the sacrifices that healthcare workers have to make. But I must say, Dr. Henry, you must admit that, one big perception as well is that they earn a lot of money.
Yeah, I didn't go into that. Now, I think we're fortunate, particularly in some parts of the world, such as Australia and the US and some parts of Asia, where remuneration for the training and for the work that we also do behind the scenes is quite fair. And so healthcare workers are able to make a decent living just because of a recognition of the training and sacrifice. But I also know in many other parts of the world, there are doctors and nurses, healthcare workers who work extremely hard, and they don't get the remuneration and the recognition, that they might be working extra long hours to care for patients outside of their own personal time. They work extremely hard, and they truly do work for the best interests of patients, sacrificing not only their time and their efforts, but even their own pay. And my full respect goes especially to those healthcare workers who may not be remunerated, but still are able to perform their duties to the best of their ability and with truly a patient-centered focus. Yeah.
Right. Thanks for making that clear. So the motivation is not the money. The motivation is the health and the well-being of patients, and for the general, for the common good and the general good, and for the good of the public.
Yeah, I would hope so. And I think for me personally, I honestly rarely check my paycheck to find out how much money that I earned in the last week, only just because, I've done the work that I need to do. And in some ways, I thank God that I'm able to be recognized that through remuneration. But there's many, many other benefits from that. And that is really in the seeing patients get better. Yeah. And I'll be interested now, Pastor Kojo, to hear about some spiritual insights about sacrifice and about what that really means from a biblical point of view.
Yeah, spot on, Doctor. I think, when we look at the Bible, it's actually full or replete with stories of sacrifice. One story that comes to mind in particular is the one that you find in Matthew chapter 26. If we can have the slide, I'll just read part of the story, and then maybe you can see what I'm talking about. So Matthew chapter 26, and reading from verse 6 and 7, there it says that while Jesus was in Bethany in the home of Simon the leper, a woman came to him with an alabaster jar of very expensive perfume, which she poured on his head as he was reclining at the table. Next slide. It says, when the disciples saw this, they were indignant. Why this waste? They asked. This perfume could have been sold at a high price and the money given to the poor. So this is one story that you find in the Bible about this woman who basically gate crashes a party, goes to a party unannounced, and then performs this scene, which basically gets everybody talking. So it says that, Simon the leper, throws a party for Jesus. And Doctor, you probably are aware that, Simon was a leper. And I think leprosy is today one of the diseases called Hansen's disease or something of that sort.
Yeah, that's right. Yeah, leprosy was a contagious disease, and thankfully we don't see leprosy very much anymore. But in those days, there was absolutely no cure. So I think that Simon was very wealthy. Unfortunately, he got leprosy, and he must have been holding a party as a celebration for his healing. And so there's no doubt that he would have been fully restored, not only physically, but also mentally and now socially. So, when in those days, when you're a leper, you're isolated, so you don't spread the disease to anybody else, as according to the rules in those days. And then now that he has been healed from his leprosy, he's holding a party just to show people I'm socially restored as well. I can have people over at my house. And of course, he invited Jesus, who was the one who healed him.
Precisely. And so whilst he's throwing this party and Jesus has come, remember that Jesus does not come or travel by himself. He comes with his disciples. So in my mind's eye, I see that the house is full. People talking, and people are having fun and people eating. And then this woman comes in unannounced. And then it says that, she has an alabaster box of perfume. Now, the perfume that she had, this jar of alabaster, was very expensive. You could only get that kind of plant and extract that kind of perfume if you travel to the Himalayan mountains, probably in India or something. So
wow, so you had to travel thousands of kilometers to get the ingredients. Amazing.
Exactly. So it tells me that she obviously worked hard and tried to save up to be able to acquire this. So back in those days, it took 300 days or a year's wages to be able to afford this perfume. Huh. And so she buys this perfume and she shows up, where Jesus is. And then it says that she pours this very expensive perfume on the head of Jesus.
Wow.
Now you will ask yourself, why would she do that? Why would you spend a year's wages, a year's salary, on a small amount of perfume and just pour it and just waste it? Well, that's what the people thought anyway, because, the disciples said, oh, she just wasted so much money. Why would you pour all this perfume on the head of Jesus? This is what they were saying, And Judas was probably very upset because he's thinking, okay, that money could have come to me, and I could have used this for this and that, But he camouflages what he wants to do. He wanted to do with the money, and he says, this money could have been used for the poor. But really, that was not his intention. He would have wasted the money. He would have used the money on himself. So Mary uses this money, uses all her money, a year's wages, buys this perfume and pours it on the head of Jesus. And then people think it's a waste. But that's a sacrifice, though. I mean, she sacrificed a year's wages for Jesus. And people are thinking, why would she do that?
Yeah,
why would she do that? And I think it is very clear that Mary was in love with Jesus. Mary loved Jesus because Jesus had delivered her from her past. She had been going through a lot of difficulties. She was possessed, and Jesus had cast out the demons, and now she was free. And she wanted to express her gratitude to Jesus. And she thought, how can I do this? What can I do for Jesus to know that I'm so grateful? I'm so happy, and I appreciate what he's done for me. And so she decides to buy this alabaster, and she spends all her money, or a year's wages, and uses it on Jesus. And that was a sacrifice. That was a sacrifice. And she did all that she could to let Jesus know that she loved Jesus.
Yeah, that's right. Now, this sacrifice is actually, Pastor Kojo, sorry to interrupt, but this sacrifice is actually on two levels, because the first level is that, of course, the monetary sacrifice. She would have had to save up a lot of money in order to buy the perfume. But on another level is that her sacrifice was that she could have done this, when Jesus was alone, or could have done it only with a few people around. But for her to do it right in the middle of a party, she must be sacrificing something else about herself as well. Maybe she wants to show people what her adoration and love for Jesus actually is by doing it in public in front of so many people. And she's sacrificing her reputation or even potential criticism for doing something so extravagant in front of so many people as well.
Yeah, and it's baffling, actually, because if you read in Luke's gospel, what she does is actually shocking. She actually uncovers her hair, because in the Middle East, women always used to cover their hair because it was deemed improper for a woman to be going about, with exposed hair. Even today in the Middle East, some countries, they still cover their hair. She uncovers her hair. Not only that, she begins to weep because of the gratitude that she's trying to express to Jesus. And with the tears falling on the Jesus' feet, she undoes her hair and then wipes Jesus's feet with her hair.
Amazing.
And so this public, what's she doing? Oh, this is embarrassing. So all this talk going on, and and people are looking at her, and so she's beginning to feel a bit self-conscious, and she's thinking, okay, right, I've sacrificed the year's wages, and now I'm getting this embarrassment as well. But it just goes to show that if somebody is committed to Jesus, if a person truly understands the sacrifice that Jesus has made for them, then there is no gift too large. There's no gift too big. There's no sacrifice too big that we will not be willing to make for Jesus.
Yeah,
but she does that. She does that, and then that's what gets people talking. So maybe we can go to the next slide so we can wrap this up. So that, because I'm sure there are questions already piling up. So it says, when the disciples saw this. Oh yeah, this is the one a text. It says, aware of this, Jesus said to them. Okay, we're going back and forth. I'll read this then. Let me read this. I beseech you, therefore, brethren, by the mercies of God, that you present your bodies a living sacrifice, holy, acceptable to God, which is a reasonable service. So presenting our bodies as a living sacrifice, it says this is our reasonable service. It's not asking for too much. I think we'll move on to the next slide. It says, going back to the story, it says, aware of this, Jesus said to them, why are you bothering this woman? So Jesus speaks up for her. She has done a beautiful thing to me. The poor you will always have with you, but you will not always have me. Next slide. Then it says, when she poured this perfume on my body, she did it to prepare me for burial. Truly, I tell you, wherever this gospel is preached throughout the world, what she has done will also be told in memory of her. So, Dr. Henry, you notice that Jesus stands up for her. Isn't it? Jesus says, let her alone. Leave her alone. She has done a beautiful thing for me. So it just tells me that basically the sacrifices that we make, the gifts that we give to God, God appreciates, because Jesus says, no, she's done a beautiful thing. So God appreciates the sacrifice that Mary was making. And that is something that we should also take on board, that, as Christians, when we do something for God, we should realize that God notices what we've done, and God appreciates our sacrifice. Can I also say this? There's a law of life, and that law says, the law of self-sacrifice is the law of self-preservation. The law of self-sacrifice is the law of self-preservation. That's what Jesus said very clearly. Anyone who wants to save his life will lose it. But if you give your life for others, in sacrificing for the good of others, or in sacrificing because of what Jesus has done for you, then you are saving your life.
Yes.
But that goes contrary to what we know in our world, isn't it? We talk about survival of the fittest and looking after number one and looking after my interest. If I don't look after myself, how am I going to be able to look after you? So everything is about me and my survival and my interest. But Jesus is saying, no, if you want to save your life, then it's about losing your life. But if you decide to lose your life because of Christ and his sacrifice for us, then you save your life.
Yeah, I think what Jesus is showing us here is that he's reaching down deep into the core of motivation of what we actually really need to do in order to get the best out of life. And that is that when we are able to give for others, that is definitely much more beneficial, and Jesus is advocating that. But even greater than that as well, when we look towards Jesus as an example of and have Jesus's power, strength, and we follow his example, then we're able to have that ongoing strength in order to keep giving And that is what I think one of the challenges can be. And that's one of the challenges definitely for professions that are constantly giving, that they give and they give and they give and they understand the rewards of giving, but they can actually burn out and have a lot of challenges with burnout and mental difficulties. But when the source comes from the true source, which is the well of water, which is Jesus Christ within us, then we have the true source of constant giving, and we're able to remind ourselves and we're able to look to Jesus as the source of strength for us and as the true example of sacrifice.
I couldn't agree more. Jesus is a supreme example of sacrifice. And remember the words that he said in the slide that's following in John chapter 15 and verse 13. There, Jesus says, greater love has no one than this, than to lay down one's life for his friends. Greater love has no one than this, than to lay down one's life for his friends. And that's exactly what Jesus did. And that's what you're saying. He's an example. You remember that, he didn't have to come to this earth. He didn't have to come to suffer. He could have just stayed in the glories, in the glory of heaven and bask in his glory and be worshipped by the angels and adored. But no, he didn't do that. When he saw that we were struggling here on earth, he said, no, I can't sit here whilst, the people I've created suffer and are under the devil's dominion. I'm going to go and rescue them. And he knew that, when he was coming, he was going to have to die to save us. In Revelation chapter 13, verse 8, it says, the Lamb of God that was slain from the foundation of the earth. So Jesus knew that he was going to have to come and die for us to be rescued. He knew that he was going to have to sacrifice. But yet, heaven did not spare any expense. Heaven did not spare any amount. In giving us Jesus, it basically poured out all of heaven. There's nothing more that God could have done to let us know that he loves us. He gave us all. And so if Jesus has given us all, then I think, the challenge is thrown to us as he's our example that we need to also give and sacrifice for the good of others.
Yeah, that's right. And I think this is the ultimate revelation of Jesus, isn't it? When we talk about revelation, revealing the true character of who Jesus actually is, we can see that so clearly through this action of sacrifice. If you want to know who this person called Jesus Christ is, look at what he's done, and what he's ultimately done is to come down from the glories of heaven down to this poor little small speck of the corner of the universe, the earth, where those of his children who are suffering, he was willing to go through what he did in order to save us. And just because of that, it ultimately shows what kind of God Jesus is. And that is a God that is full of love and full of great, immense sacrifice. And that enlightens each one of our hearts and is able for each one of us to really want to serve such a wonderful God.
In most literature, when it talks about, God, the God that is often presented is the God whom we have to appease. We have to sacrifice to God so that, he will love us. We have to, do all these things, of hurting ourselves and going through difficult times so that this God will love us and accept us. But that's not the God that we find in the Bible. The God that we find in the Bible, as Dr. Henry said, he's the example that we find, is that he's the one who actually sacrifices for us. This is unheard of, which God sacrifices for his people, for people. But this is the God that we find in Jesus, a God who lays down his life so that others will live. And that is amazing love. I can't improve on that love. I wish I had that love. And he gives us that love in us so that we can reflect that love, to others. And that is amazing.
Yeah, that is amazing. Amazing God, amazing grace. Now, we do want to open the floor to questions as well. So wherever you are on social media, whether that be on Facebook, for those who might be viewing on other social media platforms, This is an opportunity to ask questions. We have a few questions that have come in already, and please, if you do have some questions, please type them into the chat and we'll be able to answer them for you. So we got about another 10, maybe 15 minutes if there are some questions about this topic for today, healthcare worker insights, or about any spiritual aspects of sacrifice. Both myself and Pastor Kojo will be happy to answer. Now, we do have a couple of questions that have come through, Pastor Kojo. I think they're more directed on the medical side, so I might just read them out. The first question is, what do we think about the second outbreak of COVID in Melbourne at the moment? What was the biggest mistake in our public health system? How can we prevent a future outbreak? What about herd immunity or vaccines? Now, this is a very big question, and this question is very topical. What I must say first and foremost, which is an opinion that I got from one of my other infectious diseases colleagues, is that it is extremely difficult if you are a leader of a government at this time. There is so many difficult decisions that must be made because of the current pandemic, and it's not an easy, there are very few good options. And currently, as we know, Melbourne is going through a second lockdown from a second wave of coronavirus. And because of this, we're currently in stage 4 where we can't go out, but it is reducing the numbers. Now, people like to go backwards and try to look what were the issues that led to the coronavirus occurring. I'm sorry, on the call. Yeah. What are some of the issues that led to coronavirus coming back out the second time? And that is a difficult question. Could it have been managed better? And I'm sure that it could have been. But what it goes to show that this coronavirus is very insidious, and even in the most fairly strict policies that the government was able to set up, and they thought that the hotel quarantine was strong enough in terms of its protocols and strictness, even in quite strict protocols, this coronavirus was still able to get out and to get Melbourne into this second wave. It just goes to show that when a policy comes into place, or when a government or a health organisation is putting forward some recommendations, every single member of the community must be fully on board and committed, because even if there was a breach of the hotel quarantine system, if other members of the community were appropriately social distancing, or they were appropriately washing hands, then the virus would have only gotten so far. But it just goes to show that one small breach, together with some laxity in the community, is able to spread the virus around. And those other questions in terms of herd immunity and vaccines, it's a very difficult virus to control. My only thoughts about the concept of herd immunity is that herd immunity has a great cost, not only to the number of potential deaths, whether that be only 1 or 0.5% of a 18 million population is still in the order of thousands. And we must also not forget the thousands upon thousands of people who will still be incredibly sick with coronavirus and recover, but require long-term hospital care. And that will also, no doubt, overwhelm the system. So this coronavirus is just one of those diseases that is just so insidious that one small breach of our protocols can really make it spread like wildfire. And to have the wildfire, bushfire type analogy is one that I think is a really good one, just to show how one small change can make such a big difference.
Yeah, and I think, just to add to, what you just said, I think it's a good time to be praying for our leaders, the government leaders, because obviously it's a very, very difficult time for them. There's a question I was asking, how do you actually make a decision to discharge a patient in terms of coronavirus? If they've contracted the virus and you've treated them, how do you make a decision to discharge them?
Yeah, that's right. Well, coronavirus, unfortunately, at this time is one of those diseases that we still do not fully understand. And we do understand there are some patients that are asymptomatic, being they have no symptoms whatsoever, that they do have coronavirus, though, and spread them to others. All the symptoms may be very minor, just a small cough or a cold, or even a headache or something very, very, very minor, and they are infectious and spread that to other people. So the decision, in order to say you are cleared of coronavirus, we're only going that by current best evidence. And what we do know is that there's an incubation period, an infective period, and then a period of which you are no longer infective and in the recovery phase. And to get to the recovery phase is about 14 to 21 days. And that's the only, that's the current evidence that we have at the moment. And that's the current guidelines that we can use to say that a patient is now cleared, no longer infectious, and then we are then able to discharge the patient from the hospital. However, that doesn't mean that some patients have ongoing symptoms, and many do. A lot of people have ongoing breathing trouble, whether that be severe enough they need to be in hospital, or they're just not going to get their energy levels back to normal afterwards. And that can take weeks or even months before they're fully recovered afterwards. What we do understand about the virus is that after the initial 14 to 21 day window, they are no longer infectious. However, their recovery, though, can take much longer than that. And that is one of the challenges that we're going to have with this pandemic ongoing, is that we hope that patients that don't have symptoms anymore will also not be infectious. And if they're not infectious, then they can't spread that on to another person. But with great difficulty, you know, things are changing all the time. The more we understand about this disease, hopefully the more we're able to provide better advice as to knowing when someone is fully recovered and not going to spread the virus to anybody else.
Right. Yeah, thank you for answering that. Angel is also asking a question. She's asking if there are any suggestions for healthcare workers to clean and disinfect themselves after work.
Yeah, this is quite a challenge, because every day healthcare workers are being potentially exposed to the virus, and if they are exposed at any stage, then they must fully clean themselves. Otherwise, there's potential to spread to your family. Some healthcare workers are taking it to an extreme, and they might even live in a separate room. Some have considered getting a caravan in front of their house so they don't expose themselves to their families, or even living in other accommodation. Now, in terms of cleaning and disinfecting, from what we do understand about coronavirus is that it can live on surfaces for a long time, and it can also be in the droplet air for a long time as well. Those surfaces are generally the hard surfaces, such as metal, plastic, tables, things like that. Less so things such as clothes, but it can be on your skin, particularly your hands and areas that you do can get exposure to. So currently, I know some doctors who, as soon as they get home, they would take off all of their clothes and wash them immediately in hot soapy water, which destroys the virus. And they would immediately have a shower before contacting their families. I do a bit of a hybrid of that. I have my outer clothes, which I don't take into the house, and then I also immediately have a shower before contacting my family, and I'm quite meticulous about washing my hands at all times, even going into areas such as the car and outside of the car. I'd wash my hands again just in case, and that's only just because of my higher exposure that I may have to the virus as opposed to other people. So it's just about being vigilant, and I would say that there should be a regular routine that healthcare workers should have in terms of cleaning themselves as soon as they come home from work or from environments where they could be exposing themselves. For members of the community who may not have the same level of exposure, they may not have to go to such extremes. But for those who do have the level of exposure, I do recommend it. And it's quite interesting, Pastor Kojo, that some of these protocols have actually been suggested in the Bible before. Is that correct, about washing and things like that?
Yeah, interestingly, you go all the way back to the book of Leviticus, and God made it very clear that, if somebody had any type of, skin disease or disease that, looked threatening, they had to wash themselves, isolate themselves, and clean themselves. So it's interesting that, science has finally caught on, to what the Bible says. So especially, considering the fact that, this was written thousands of years ago. So obviously, there's a lot of insight and, scientific knowledge, even in the Bible, although, sometimes it's not presented as such.
Yeah.
So,
I think I must admit that one of the amazing things about that was because God gave some of these directions thousands of years ago when we didn't have the understanding of things such as bacteria and viruses. And for God in his wisdom to recommend this, but then to try to communicate that to a group of people who had no understanding of what infection and diseases was actually like would have been such a challenge. And for people in those days, they had to have a very close relationship and a great trust in God to know that these things are right, that you can stop diseases by doing things such as washing and isolation. And it would be very difficult to understand that without the knowledge that we have today.
Yeah. And so, yeah, we might as well apply those principles. And those are the principles that you've just explained. So thank you very much. Now, I think we'll probably have to wrap up. But next week, we're back here next week. And we're looking forward to a fantastic program again. So please join us next week for online church. Is there anything that we have to do, Dr. Henry? Do we have to pray before we go?
Yeah, I think it's great that we can pray. And we also, once again, thank all of our viewers for joining us today. And this will be posted online, so you are able to view it again or to share it with your friends. And any further questions, we will have more time next week to answer questions as well. So thanks so much. And yeah, let's close off with a word of prayer, Pastor Kojo. Would you like to lead us, please?
Let's do that. Father in heaven, we thank you so much for the time that we've been able to spend together. We thank you, Lord, for helping us to understand the sacrifice you've made for us. We pray that you bless our viewers and draw them to you, let them come to know you. And I pray that you be with them and be with us as well. In Jesus' name I pray. Amen.
Amen. Thank you. See you next week.
See you next week.